Welcome to Apaga University. I'm Inga.
And I'm Julie. We are two
momtrepreneurs
who have built an in-home care business from the ground up, guided every step of the way by God's care and fueled by agape love.
16 years later and over 100 podcast episodes already under our belts, we invite you to continue on this journey with us as we share stories that resonate, insights that inspire, and practical guidance that empowers you to face any obstacle along this path.
Whether you're a professional caregiver, a family member, or are simply curious about what your steps will be when you need them, you have come to the right place.
Oh, hey, and while you're here, make sure you hit that subscribe button.
And after that, make sure you send this to a friend.
Yes, do it. All right, we'll quit fooling around and get to it.
Let's go. Class is in session.
Hello, Sunshines, and hello, Julie. How are you?
Hey, you bossy old hag.
Hey, I have a headache.
She's bossing me around.
I know. I was given bossing orders about the pizza.
Oh, I know. It is priority.
So we're gonna get this done so we
fly
can
right
have
through this one because we got
pizza.
a reward coming.
Oh my goodness. Well, let's see. I don't know what's new since last I sat at this table with you. Anything?
Oh, I have a zit.
Oh, awesome.
Bummed
my
out.
eye itches.
I just get so mad. I am of elderly age now, and so I should not get any said imperfections. And my hair looks crappy today. It's just one of those things that if you're listening to us versus watching us, you are having a lucky day. So you are welcome.
I have a friend who uses the word lousy a lot. She'll talk, oh, it's just a lousy day. And I can't help, I'm not trying to diminish what she's saying, but that word just gets me. Lousy. Isn't that a funny word?
That is a very funny word.
Yeah.
I think I'll start using
It's
that.
just lousy when you get a zit. I'm sorry that happened to you.
Dang it.
All right. Well, anyway, I guess let's just get rolling with the verse.
Rolling.
Let's do it. This is Ephesians chapter 4, verse 29. It says, when you talk, do not say harmful things, but say what people need, words that will help others become stronger. Then what you say will do good to those who listen to you.
Yes. Good
Are
to
you
live
telling
by.
me to be nice?
No, what it says is that you have to say what needs to be said.
Oh, good. But not harmful things.
Well,
What people need.
Well, so you've always said this, you know, if somebody hears somebody say something naughty about me, do you just run and tell me? Yes, you do. But you can, because then I get all fired up and ticked off and sad. No, because I don't care what other people say. Thank goodness, got these broad shoulders for a reason. But really, truly, if you're telling me harmful stuff that's going to hurt my feelings, do I have to know it?
Right.
Or was it something that they were just saying because they're just talking words?
Yes. I've always tried to say with my girls, especially because, you know, being a middle schooler and a high schooler and a young adult and in the workforce and a person in general, people like to talk and they like to say things that you might hear someone say something about a friend of yours. Well, does it help that friend of yours if it's just nonsense and someone's saying idiotic things for no reason at all? What does that benefit your friend to go and say, oh, so-and-so said this about you?
Right.
Like what good does that do?
Exactly.
Right.
It's pretty lousy.
It is pretty lousy indeed. Well played. But yeah, I don't know.
So that's how I read that.
Yes.
However, like in our business, we don't sell tacos or t-shirts, right? We sell a commitment to serve.
Yes.
And so if I or you see something that we don't feel is meeting our expectations, we need to talk to that person.
Yes, absolutely.
Now, that causes problems
At times.
because you have to be very cautious on how you share that information. But yet, is it the right thing to do?
Yes.
It is. The right thing to do is not always the easy thing to do.
That is very true as well. And sometimes people do need to be made aware of things that are happening or, you know, if it's just gossipy, whatever, that's one thing. But if it is something genuinely that could have a negative outcome or impact, someone might need to know that. And like you said, it's interesting because you present information to different people differently, right?
Right.
So some people you have to like hit them over the head with it. And then some people you just have to use a feather, right? And you're really good at that because you're managing caregivers every day and there's a lot of them. And so you have had to figure out, okay, how do I talk to this caregiver versus how I talk to this caregiver? I think you mentioned it just in some discussion earlier. Like some of them you have to talk to like a sailor to make sure that they understand what you're saying, right? And others would fall out of their chair if you used a curse word at all.
Yes,
right?
yes. Well, and I can come across very, very stern, and it's just who I am.
Right.
I one time at my motorcycle track, I had a dad come up to me. He goes, "Man, that was the nicest ass chewing I'd ever gotten." Did I chew your ass? I was just making sure you got my point, but I obviously came across quite firm. Shall we say firm?
Firm. There you go.
Yes.
It's a good word.
Yes. So anyway,
I had a birthday recently and I was so spoiled. I always am. But I don't know if you ever see on like Instagram, I follow this account that's called Disappointing Affirmations. And somebody in my life knew that I needed this book. But it's funny because it's so Instagram, all of these like inspirational things that you see on there, they're amazing. And I love it. And I draw a tremendous amount of inspiration from a lot of the things that I see on there. But I also find these disappointing affirmations to be equally useful because sometimes it's like, you just have to lighten it up a little bit and like, you know, just let it go. Right. Like, so I really felt like I needed to read a few of these. Of course I picked this out before I, looked at the verse. So, you know, listeners can decide
well, to
whether
be
or not
honest,
I'm doing harm
there
or good.
are many, many times I'd rather give a disappointing affirmation than being the kind soul that I am.
Oh my gosh. Get this book. I am telling you, get this book.
I have to have a birthday.
Oh my gosh. So the first one says,
hint, hint.
Might have gotten it from the producer. The first one says, don't be sad. You're making everyone uncomfortable. I love that. I mean, because how many times are you with someone that's sad and you're just so uncomfortable? You're like, I don't know what to do with this. But anyway, another one. Things didn't work out for a reason. The reason is you make terrible decisions. That one's good. Whenever someone asks how you are, just make up a lie. Like, I'm okay. No one wants to hear about your problems.
Fact.
This one's great. Stop worrying about what other people think. I mean, have you met other people? They're awful.
That is actually should be titled The Book of Truth.
Isn't it? This is the reality.
That's reality.
Because how many times have you ever done this where someone's like, oh, how are you? And you're like, oh, well, I've got this going on. And like, I'll get like 3 words into it. And I'm like, why did nobody, they don't want to hear.
Yeah.
They don't want to know.
Yeah.
Yeah. Anyway.
That's funny. Pop off a couple more.
Okay. It's okay to have feelings, but do you need to have so many? Have a panic attack. You've earned it.
Oh, thank you.
Yes. Prioritize your mental health. Have a good cry every morning as you question everything about your life. That's it.
Oh.
I can't share them all. Otherwise you won't go buy the book so that you can read the rest of them.
I still need to hear them every day. Oh my gosh, that's funny. Mine is much more serious. So basically, there's a new process that vaporizes plastic bags and bottles to help make them recycled materials.
Oh, wow.
Because don't you know, like every time you buy a bottled water, my dad, I know he's in heaven and he's cringing because he could never understand why anybody would buy water, right?
My Grandpa Fisher was the same.
Yeah. So anyway, but they always say it's like a bazillion bottles are in the landfills and on the roadsides and stuff. So anyway, they're coming up with this. It's a big word, so I'm not going to try. But it's a chemical procedure that turns waste items into this compound that's making then new material.
So it's like recycling it.
Yep, again and again. So it also efficiently degrades a mix of the 2 types of plastic, because there's 2 types, ethylene. Oh, see, I said I wouldn't say any of those. Polypropylene, the stuff of hard plastics from microwavable dishes to luggage. So there's all of these Eileens out there that they're actually
We love a good Eileen.
figuring out how to break them down and rejuvenate to be able to use again.
Wow.
So that's awesome. And so that will help our landfills a lot.
I was thinking about this last night because we went to a baseball game. It was the first one that I'd gone to here. And anyway, as all of these balls are getting hit like out of the stadium, whether they're going, you know, not home runs. I think there was one, but anyway, they still go out. I'm just thinking about hundreds of thousands of years from now, someone is going to be digging on that particular site, finding all these baseballs, wondering what in the world we were doing.
Oh, that's funny.
Yeah.
Yeah. We went to the lake last weekend. It was like the last summer day-ish thing. And so we thought, well, let's just go. And as Mike was out and kind of walking up as high as his knees, he kind of bent over and he found a golf ball.
Yeah.
And I have found golf balls in my pasture and we are nowhere near a golf. I'm like, where do these golf balls come from?
I know. When we moved out to where we live now, before we ever built out there or anything, we would just walk around on the property and there were probably hundreds of them. Somebody just had a ball hitting them all out there.
I know. I don't know if a stupid bird picks them up.
Oh.
And then says, oh, this looks like a good place to plant this.
I don't know.
This golf ball tree.
Yeah, I don't know. Anyway, well, that's cool. There's just always so much technology and things like creative things that my mind can't comprehend.
I am very thankful for those that think that way.
Yeah, absolutely.
Yes.
For sure.
Yes.
Cool. Okay, well, today we are going to be talking about oral health and how really, really important it is.
It really is. And I got to tell you, since I kind of bear all anyway, I do recall one time I did tell my dentist that I'd rather go to the gynecologist than to them.
Yeah, I'm pretty sure I overheard the phone call. I think you were on there. I'd rather have a pap smear than have to go to the dentist.
I can't stand the smell. I can't stand the sound, the pain. It's just a lot of ick. It's lousy.
It's lousy. I know. And I've known a lot of really nice dentists in my life.
Very nice. Yeah. But also, when I was going to a trade school back in the day, I was going for my medical assistant degree. All of my friends were dental assistants. And they're like, Julie, come over to our side. And I'm like, I just can't. I don't even like to say the word dentist. It's nothing personal.
So you did all of the dentists in the world a very big favor by
I would rather poke somebody and draw blood and do all of those things, but look in somebody's mouth, it's almost right next to feet.
I thought you might be going there.
Yeah.
I know.
Yeah, and it's dumb because I definitely need some work done. I understand. And every time I see somebody make a big, huge smile and they've got these beautiful teeth, I'm just like, dude, how many times do you go to the dentist? Evidently, you're supposed to go to the dentist twice a year just for cleanings.
Turns out, not once every 20 years.
Turns out I'm behind.
I know, me too. And my parents did a really good job of getting me nice, straight teeth.
Yes.
Yeah.
Yeah. So how oral health can affect your heart, your brain, mental health, the whole shebang. So
all of the shebangs.
Yeah. And as we get older, it doesn't stop. You know, I have a friend right now that she actually has a mobile teeth cleaning service, and she has an account or several accounts where she goes to many different assisted livings.
Yeah.
But I'm just like, I just can't even imagine.
So if I hire her to come here to the office,
well,
as soon as she pulls up, you're going to go sneak out the back door.
The problem with her is I do like her a lot, so I don't want her to have to see this. I
think you're more worried about it than...
I'd rather, I guess they see everything, like cheeseburgers stuck in the cracks and...
Probably even broccoli.
Oh. Anyway, okay, let's get serious.
All right, tell me something.
Serious. Okay, dental cavities could significantly increase the risk of a life-threatening stroke from bleeding in the brain, according to new research. Past studies have shown a link between gum infection and stroke, but few studies have looked into what role dental cavities might play. So in this new study, researchers looked specifically at cavities in intracerebral stroke. This is terrible news. I don't like this. So anyway, that while brain bleeds, also called an intracerebral hemorrhage, accounts for only 10 to 20% of strokes, they are more deadly than the more common ischemic strokes, which occur when blood flow through the artery is blocked.
Oh.
So while doctors can manage the risk for the ischemic stroke in several ways, options are limited for brain bleeds. So this study throws out how more light on how we can address and prevent this devastating form of stroke. And they said that in one of two studies, basically the second study showed gum disease is associated with damage to the brain's tiny blood vessels. And that's crazy because gum disease can be caused by 20 to 30 different types of bacteria, where cavities are predominantly caused by a streptococcus mutant, which has been shown in animal studies to be linked with brain bleeds.
Wow.
Isn't that something?
That's wild.
Yeah. Yeah, so these mutants are most likely the culprit in the results of this study. So basically, the only real preventative strategy for cavities is to seek dental care regularly. Maybe we need to start thinking about how we can treat people with the mutant aggressively in the early stages.
That's crazy. Think about like even the difficulty of getting some of our elderly people to the dentist.
Oh, yeah.
And or then I was thinking about, and I don't even remember when I had this thought, but think of someone with Alzheimer's or dementia and how you would even go about doing this type of invasive.
Well,
even
if I had it,
well, okay,
I would hate it because I hated it in my normal life.
right.
We have a client that goes to the dentist quite regularly who has pretty end-stage dementia, but he's a delight. He just sits there and opens his mouth, and he must have loved going to the dentist his whole dang life.
Wow.
Isn't that weird?
Yeah.
But it could be very scary for some, and so they're going to say, forget the dentist. This is one more thing we'll just deal with.
Right.
Yeah, so I'm just thinking I have to go buy me a lot more Listerine. So, but what they're finding is that stroke doctors don't counsel patients on this connection. And it's just, he said, basically, it's just nothing that's in their toolbox.
Right.
So I discuss it with every patient I see, regardless of what they're seeing me for. I tell them, take care of your teeth. It's important for the health of your teeth, but so much more, it's good for the health of your brain and your heart.
Wow. Okay. Well, take care of your teeth then.
Yes. Now, with mental health and dental health, that's a very interesting concept as well.
Yes. So it's not widely understood, but there is a clear connection between a person's dental health and their mental health. I guess I can see it the more that I was reading about this, the connection and some of the things where you might go off track with if you don't have good dental health. But basically, when a person has poor oral health, it can impact their eating, speech, and self-esteem and lead to reduced social interactions. And that's not good for your mental well-being, right? Well, some of them, the bad social interactions you don't want, but just withdrawing is not necessarily a good thing. Many people, including people with mental health conditions, have anxiety associated with dental care and procedures and avoid needed care. But chronic oral pain can contribute to poor mental health and make treating mental health conditions more difficult. Symptoms of mental illnesses can contribute to poor nutrition, which in turn contributes to poor dental health. People with mental illness, particularly those experiencing symptoms of serious mental illness, may have difficulty maintaining an effective daily dental care routine and accessing needed dental treatment. So it's kind of like a vicious circle, I think.
Yeah. Well, and not to add, it is just damn expensive.
Going to the dentist.
Going to the dentist.
Yeah.
I mean, I have a quote for everything that needs to be fixed in this here hole, and it's enough to make you want to cry.
Yeah.
And it's not like it would all happen all at once, but knowing that it would take several visits, which to get you there the first time is bad enough, but then to know that it's going to cost you a handful of thousands, that's a problem.
Yeah.
And a lot of people don't have that.
Yeah, don't have the cash sitting around for it and or don't have a dental insurance or.
But of course, now I'm telling on myself, basically probably a lot of my woes are caused by myself because I could have taken better care.
it's always preventative,
Yeah,
right? It's
it
always
really
get
is.
to the dentist, do
Yeah.
your 2 checkups and cleanings a year, and stop the problem before they become a bigger problem.
Well, one of the things that I also think about is like, I'm old now, right? So mother took us to the dentist like a lot. We were well taken care of. It was one of her priorities. And that's also a thing, is priorities, right?
Oh yeah.
But my cavities, my fillings are those old, ugly, silver.
Yeah. I have a mouthful
So
of them.
you know, when you smile, people see that. Nowadays they make them white and pretty and all of this and that.
Yeah.
Much more cosmetic. But to have that perfect glowing set of teeth that goes along with my personality, I would have to do a really big
Major overhaul.
thing. Yeah.
But we're always harder on ourselves, I think.
Well, now everybody's gonna be looking at my dang mouth and just knock it off, everybody.
Okay, stop it. So when I was growing up, I seem to recall, and maybe my mom will correct me if she watches this podcast and I'm wrong, but it seems like I worked really, really a lot harder than my brother to take good care of my teeth and did not have as good of results as my brother had not doing anything.
Oh, there are some people that are predisposed to having just cavities and issues. Boy, one of Molly's friends, it runs in their family that they just have super soft teeth. And so he's in his young 20s, mid 20s. And I think they already just pulled them all and gave him dentures because they were just like chipped and falling apart. And there's not a lot hurts more than a toothache.
It was about the worst.
Yeah.
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 So 4 key dental conditions seen in patients with psychiatric disorders: tooth decay, gum diseases, dry mouth, and teeth grinding. Dry mouth can be a complication of anxiety and is a side effect of many psychotropic medications. They suggest that over-the-counter products in those cases, like an oral moisturizer, mouth rinses, toothpaste, those types of things, they can be very helpful for dry mouth. Teeth grinding, which can damage teeth and contribute to teeth and jaw pain, is treated by wearing a night guard and working with a psychiatrist to address medication side effects and psychological factors. Therapy can be helpful if a person is extremely anxious about going to the dentist. You know what I did? There was a time when I was either grinding or biting, or I was just having a lot of pain. I went and got one of those mouth guards that the kids, like football players, use.
Oh yeah.
So I just went to, I think, Sportsman, and you basically you heat it up, you put it in your mouth, and you like bite down and suck so that it shrinks to your. Yeah. And then I just wore that at night. It's this obnoxious purple thing. Because again, if you go and buy, which I'm not giving medical advice because maybe that was not the right thing to do, but it worked very well for me.
Isn't that funny?
To help with that.
It was that when Kevin turned around in the middle of the night, he was like, oh!
Yeah, pretty much. It was a jump scare.
I forgot you had that darn thing in your mouth.
Yeah. But it was like a $5 solution to a problem versus,
thinking outside the box is a big deal.
Yeah. So talk to us about oral health and dementia.
Oh boy. Oral health is of particular concern of older adults. Poor oral health is common in people with dementia who have difficulty with daily routines or engaging in more comprehensive oral care. So also they found that associated periodontal disease and tooth loss with a higher risk of the dementia. The mouth is a part of the body, and if you don't take care of oral inflammation and infection, you cannot really prevent systemic diseases like Alzheimer's.
It's just crazy. God made this body to all work together. And so
in sync.
Yep.
Yeah. And you don't realize how important something is until it doesn't fit or do real good, you know?
Yeah.
I mean, like if your thumb, I just had the itch. That just was it. But you could, if your thumb is having a problem, you can't hitchhike, even to pick stuff up, you don't even think about how often you used your thumb.
You can't hitchhike. I've never hitchhiked. Have you?
No. I would be too scared. No, I haven't. Don't give me that look.
So okay. I think the point is really just emphasizing the importance of collaborating among the entire healthcare team, right? So this is your dentist, your physicians, social workers, mental health professionals, others, and paying attention to how that dental health can impact your mental health.
Yeah. Yes. So basically, yes, dental health can affect your mental health. A lot of it even boils down to self-esteem.
Yeah.
Basically what dental health tells us about our mental health. If you feel depressed or anxious, you're not going to take care of yourself as well. How can I manage my mental health and dental health? Eat a healthy diet and a large variety of nutritious foods that will boost your mood and protect your teeth and gums. Keep an eye on any signs and symptoms that you might have. You're supposed to floss. You're good at flossing. You floss at really weird times.
I just have these sensitivities, and if anything gets in between my teeth, it drives me insane. I'm going to be really, really hard to handle when I get old. Like Sammy and Bailey and Kevin have this list of things that they have to make sure to do. After I eat, somebody's got to floss my teeth if I can't do it anymore, because I am a real problem when I have food stuck between my teeth.
So if you're cranky, they're going to pry open your
get the
mouth
floss.
and say,
Somebody get the floss.
There's her dinner.
Make sure that my feet aren't claustrophobic in socks. Make sure that my ears got swabbed out with a Q-tip after a bath or a shower, because, I don't like water in my ears. Yeah, it's a long, extensive list, so someone has a lot to look forward to.
Maintenance.
I am too. I resemble that remark.
Oh, my Lord. Dry mouth can also be a side effect of certain antidepressants. So that's rough. You got to take your meds, but then it might cause another scenario.
Yeah.
If you suspect you might have dry mouth, make sure that you check with your dentist, doctor, and therapist to make sure you're not hurting your teeth.
Yeah.
And practice stress reduction. If you notice that you have worn enamel, this is an indication of high levels of anxiety and stress. I did not know that. In that case, you might want to practice some stress and anxiety reducing activities: meditation, deep breathing, de-stressing, refocusing, be calm. And
just calm down.
Calm down. See your dentist. They're not just there to polish up your pearly whites. They can also detect when other things are going on in your life. They also can make referrals to counselors and therapists. I didn't know that a dentist would do that.
I didn't either.
Yeah.
Also understand that dental phobia it's a real thing, right? So
is that what I have?
Maybe. I mean, so don't get too hard on yourself. And there are people out there that you can talk to about it to help you try to get past that, because it's real.
Well, and the funny thing is just like everything else, the anticipation of it all is way more worse.
Well, and people handle things differently. So I know people that will get cavities filled without anything, right?
Yeah.
But there's also people that are like, they're going to clean my teeth. I better have some Versed or something. I can't be awake for this or alert or aware, right? So, but I think talking to your dentist and being very forthcoming about that can help with that process, because I would only imagine that the dentist wants it to be as easy on you as possible, because the easier it is on the patient, the easier it's going to be on the dentist, right? So, and there are things out there that can help you try to overcome those, or at least make it through.
Well, one of the worst things I ever saw, and I believe I've told this story before, when I was working in the ER, was a woman that came in and she had such bad oral health that literally she had dentures and they couldn't just come out anymore. They literally had to take pliers and literally reef them out of her mouth.
I know.
And now that I look back on that, I don't know that, well, I'm sure they did, but just as a bystander, I never anticipated that probably associated that was her mental health. So poor thing.
Yeah. Yep.
Yeah. Dang.
Well, what are you leaving us with?
In the nick of time.
Oh, just in the nick of time.
Yeah. And so that means an action performed before it's too late. The real meaning is there's a lot of old sayings that relate to money and debt. This one originated in the 18th century. People kept track of the money they owed to creditors with a stick. A nick was carved into the stick every time the money was overdue. If you paid before the nick, then you didn't owe interest on the debt.
What?
In the nick of time.
Wow.
Yeah, that's all new.
Yeah, I did not. I mean, I've heard the saying a million times, but I did not know the origination.
The real, yeah.
Cool.
So
awesome.
Anyway, that is that.
Well, thanks, man.
Yeah.
Peace out, Girl Scout.
Go to the dang dentist.
We leave you with that.
Have a good day.
The Caregiven name is a registered trademark of the Veritrust Health Incorporated Company. IPAGA is not connected to, affiliated with, or endorsed by Veritrust or any of its affiliates.